Hello everyone, we are Group 3 from CHM 5002 Laboratory Safety. We would like to introduce ourselves first. My name is Ali Faris and my other two group members is Ms. Rafida and Mr. Muhammad Hayruddin. Our topic today will be on emergency first aid for poison. Here are the main topics that we will focus on during our presentation, which are the cause of poison, the symptoms, the treatment, and the controls, how to control or prevent the poison from happening. First is introduction. Poisons are compounds that when ingested, absorbed, injected, or inhaled, cause disruption of normal body function, usually through chemical reactions or activities on the molecular scale. It may or it can cause death, injury, or harm to organs, tissues, cells, and also the DNA. The international pictogram for poisonous substance is the skull and crossbones, which is symbolized as acute toxicity. Now, my friend will talk on the cause of poison.
I'm going to talk about the cause of the poisons. So there are four pathways in which poison enter our body. So the first one is through injections, when we swallow or eating something through our mouth. And next one is through inhalations. It happens when we breathe in. And there are few poisonous gas such as H2S. Next is through absorption, is through in contact when the poison or the chemical in contact to our skin. And last but not least is through injections. It can happen by when it was injected by using syringe, or it can happen when we are bite by animals such as insects and snake. So the speed with which the poison acts can be influenced by different criteria in which the poison enter our body. The first and the most dangerous way in which when the poisons enter our body through intravenous injection, in which the poisons enter our body through injection into our vein. Next is through inhalations, when we inhale the gases into our lungs. Next is through intramuscular injections, when the poison will injected into our muscles. And next is through injections. Injections happen when we eat the poisons such as food, and also food that contaminate with the chemical. Next but not least is through dermal absorptions, when our skin are exposed to the chemical. There are many symptoms of the poisons, and the symptoms of the poisons depends on the type of the poisons and the amount of poison taken in by the victim. But generally, there are things to look for, which first is vomiting, and next the victim can feel stomach pain, and then the victim can have confusions, and last but not least, they may happen drowsiness and fainting. Next, I pass to the next presenter, Ms. Rafida.
Okay, here I will share basic knowledge and practices in managing poisoning. These general approaches facilitate decisions of the treatment methods of poisoning. However, it depends on which poison the patient is taken, how much it was taken, and how it enters the body. The poisoning can be occurred indoors and outdoors. We must make sure the safety for ourselves, the patient, and any others before approaching to give first aid. The treatment has been divided into four. The first one is ingestion of poison. Swallowed poisons vary in their first aid treatment. The substances affect the body differently. Here, I listed 3 steps or 3 approaches to assist the patient. The first one, quickly determine what was swallowed. The second, we have to try induced vomiting that can remove the substance before it is absorbed into the body. The last one, try to give the victim something to dilute the poison. Now we look on the second treatment, which is caused by inhalation. Sometimes people accidentally swallowed or breathe in something they shouldn't. This situation may damage lungs and other organs. Here are 3 methods to assist the patient. The first one, quickly get the person to fresh air. Next, we have to ensure clear airways. Last one, try to create artificial respiration and oxygenation. We move to the third treatment, which is caused by absorption. Poison that can be absorbed through the skin and eye. Poison can come from many sources, including plants and pesticides. Here are 2 poisons that can cause to skin and eye. Okay, the first one, poisoning on the skin. Try to remove a poison quickly to limit exposure to the body. The second one, remove contaminated clothing. Next, we have to rinse the skin continuously with water and soap. And also, we try to apply antiseptic cream in case of stings. Now we look the poisonings on the eye. What we need to do? Immediately, rinsing the eye with water for 15 minutes. Then, we have to ask the victim to blink the eye for a few times. We move to the last treatment, which is caused by injection. Injection of poison, insect and animal stings, and bites are among the most common sources of injected poisons. Here, I listed 4 treatment, 4 steps to assist the patient. First one, move to the safe area. Second one, try to remove the stinger. If we have the experience, we can try to suck out the venom. Then, try to wash the injured area with water and soap to prevent the infection. And last one, if the pain and swelling happen, try to apply a cool compress or ice pack. And also, we can get the calamine lotion or a baking soda paste to the injured area. I pass the next presentation to my friend.
So now I will talk on controls. How can we prevent poisoning? First, organize household substances out of the reach of our children. And also, we should follow all product label directions. We should wear protective clothing like gloves when you use cleaners and chemicals while working in the lab. We should also install a gas detector in workplace, such as lab and home. Plan for maintenance of the equipment, vehicle, and product, and manage chemicals in the lab. For summary, proper first aid can reduce risk and also minimize injury and save a life. Provide treatment on your own ability. Always reassure victims of their safety and pay attention in the current situation. And finally, obtain medical help immediately. And that's all for us. Thank you.